Hello friends, Dr. Larry Mitnaul, your friendly neighborhood child and adolescent psychiatrist. Thanks for tuning in again. So many of you have been doing such a great job at sending me your questions about the things that you're most interested in. And so one of the things that's come across to me that I wanted to be sure to respond to is, it sounds like there are a lot of young budding child and adolescent psychiatrists out there. And I thought it'd be worth our time to think about what are some of the things that psychiatrists do? I mean, what does that lifestyle look like? Now, hopefully if you've been watching, you've already seen a video of what my clinic looks like. And I've talked a little bit about what a typical encounter might be like for me in terms of first getting started with a patient or seeing them in subsequent visits. But you know, there's more to psychiatry than just what I do. And so the great thing is that there are many great options. So let's take some time to think about it and explore it in this video together. So thanks for tuning in. Let's get to it. And before we jump into the content, don't forget to smash that like button, okay? I mean, just demolish it, make it go away. As we've talked about here, it helps us to reach more and more families with this message of kind of hope and resilience. And so you doing that actually is a really great service to the world. So, and certainly we appreciate it here on the channel. So thank you for doing that. Now let's get to it. All right, so the first style of practice that I will describe is the way that I practice actually, which is an outpatient child psychiatry, meaning that, you know, I've set up an office and a team that's there focused on kids getting to see me kind of one-on-one, for us to think about crafting a plan after I get a chance to really know the child and the family, because often our treatment plans revolve around both things kind of working in sync. And so that type of practice might be connected to a hospital, but actually could also be its own independent thing. And so it turns out that many child psychiatrists in the world, and certainly in the United States, actually are private practice. So they might not be connected to any other kind of entity. Typically, that type of practice has an individual child psychiatrist in it, especially if it's private practice. But if you're in an academic setting, there might be several, actually, child psychiatrists who are also seeing a number of patients, probably supervising trainees who are also training there too, but they're seeing people in the outpatient setting. So what defines the outpatient setting? Well, you're not in a hospital. So you're going to, you know, a building or a setting where, again, you're meeting one-on-one often, and so that is on the tier of psychiatric care. We can think of psychiatric care being delivered in a spectrum, meaning from least intensive amount of services in terms of supervision and time intensity to the most intensive. So what would be the most intensive? The most intensive would be, you know, someone who is hospitalized. So someone who's so ill, who's so sick that they require, you know, continuous 24/7 supervision while working on a really intensive plan and maybe doing some evaluations there. And so outpatient treatment is perhaps the less intensive of those, meaning that, you know, it doesn't typically take you outside of your day-to-day life. So you're probably going to bed, or your child is going to bed, you know, in their own home. They're missing some school to go to one individual appointment, but they're not missing, you know, weeks on end or several days in a row in order to do that. And so outpatient setting is probably the most common way that child and adolescent psychiatrists practice in the US. All right, so using that analogy of the spectrum of psychiatric care, and we're going to move up in intensity, the next level may be something like what we call community mental health care. So that would often be, you know, services that often are subsidized by, you know, local taxpayers too, that usually include a number of things. So not only a child and adolescent psychiatrist might be part of it, but typically it also involves, you know, maybe case management services or social work services or therapy services as well, all kind of integrated together, meant to work as a whole. And so there's some kids who benefit from maybe more intensive services. Now, that's not to say that in the outpatient model you can't also get individual therapy or maybe some other social work services, but those things tend to be kind of special features of a particular clinic Whereas community mental health, the model is built around having this integrated structure working with kids. The other thing that I put kind of in this middle section in terms of intensity of care might be programs that are specialized, that are geared to help kids and actually may require a little bit more intensive time than you might see in an outpatient setting. Okay, so for this, I'd like you to think about a couple of things. So I might take a diagnosis like obsessive compulsive disorder, right, where someone is so obsessed, their mind keeps ruminating and going round and round over particular things, or they're unable to really break free from certain habits that are keeping them tied down, that are really restricting their world and restricting their life to a very narrow thing and keeping them from, making it to school or establishing really great relationships. Okay, some kids and some adolescents and some adults might be struggling to such a degree that maybe they might benefit from an intensive program that just focuses on treating OCD. And so there are specialty clinics where someone might go and spend, say a week or 3 to 5 days, doing just really intensive work around that particular diagnosis. And so child psychiatrists also work there in these places where maybe they focus in on the particular diagnosis that they are most excited about and most interested in treating, and so they can spend time just continuing to perfect and craft that while working with some of the most intense features of the disorder from people who are coming from all around. Similarly, there are things called partial day hospitalization programs or intensive outpatient programs too, which also fit kind of in this middle tier in terms of intensity, because they often require families or kids to spend more time outside of the home in order to get that type of care. Again, that care can be really broad too and apply to a lot of kids who may be struggling with various different things, including anxiety or depression. And so that is another way in which child psychiatrists practice. And again, in ascending order, last but certainly not least, is hospitalization. So working on an inpatient unit. And that might come in a variety of ways, because there are private hospitals and nonprofit hospitals. There are state-run facilities as well. And so the way that can look very, very different, but there are many child psychiatrists who feel called to kind of focus on really meeting families and meeting kids when they're at that crisis point. And so when they're requiring hospitalizations to keep them safe or to work on a really early intensive plan to help them get back and reintegrated to their community, to their school, to their family, this is a really great place to do some tremendous work in that arena. And so again thinking about psychiatric care, this would be the most intensive option typically for treating kids. And last but certainly not least, I'm going to put an other box, okay? I'm going to call it other because, to be honest, with child psychiatry, there are so many ways to practice. In fact, even though there are, designated roles and people hiring for child psychiatrists, the truth is we're so underserved that if you called around and pretty much, anywhere around the United States, you could likely craft and put together an opportunity even if an existing job didn't exist, or that someone wasn't, asking for help in child psychiatry. And so what do I mean by that? So for instance, for juvenile detention facilities, for instance, there's a good number of those kids who have experienced, early life trauma, maybe some separation, perhaps, ADHD and school-related issues, and maybe those things have also contributed to why they've ended up there, right? So it's not an uncommon story for us as child psychiatrists to see people in clinic who may have had, and I'll use ADHD since I just mentioned that, but may have had some undiagnosed inattentive issues, hyperactive issues, and so rather than being called ADHD, they were called BAD, right? And so because they lacked either the resources to be able to manage it, maybe their school lacked the resources to manage it, perhaps there wasn't someone in their life who was able to help them to come up with strategies to help them manage it. These kids can go through school and have a really tough time and be really frustrated. And so rather than attending school and it feeling like this exciting place they get to go to learn new things. They constantly feel frustrated. Maybe they feel like, a burden to other peers, and maybe they lock into a peer group that is a higher risk, is maybe using substances, is maybe doing things that are, that we'd call kind of conduct, disordered, and that tends to lead them down kind of an opposite path. And so again, a lot of the kids who may be connected to these agencies because of delinquent behavior may actually have some underlying psychiatric things that just are either undertreated or maybe underrecognized. And so child psychiatrists can have a role there at really helping these kids. Another area is social services. So you think about kids who maybe are in the foster or adoption care system in a particular state or county, or kids who have been identified because the family's been reported maybe by a pediatrician or family member, and they're in need of particular services. And so there may be a child psychiatrist who's at the front line helping to identify resources for these families, evaluating these kids, and helping them get the services that they need. There are some really savvy school systems too who have set up clinics kind of accompanying the school, and so bumps and bruises can also get mended there in the clinic, but maybe there's also some psychiatric care going on in those places too. And so again, honestly, the sky's the limit in thinking about where could mental health be helpful. Now, I'm going to be biased. I think it's everywhere, right? And so you can think of psychiatrists who might work alongside a big church diocese. Maybe they have a school, or maybe there's a private school system, or maybe there's a public school system as well. I mean, child psychiatrists are present in all of them, or can be present in all of them. Unfortunately, there aren't, again, a lot of us to go around, and so many of us will make ourselves available to many of those different options to help those kids and to be sure that we're trying our best at helping them to get the care that they need. So that big umbrella is called other. Now here's my homework for you. So some of you may have some things that you're thinking of that fit in this other category, or maybe there are things about the other areas that I've talked about that you'd really like to hear a little bit more about. Well, I'm happy to provide that and to dig into some of the details, or take you through a day of what that might look like based on my experiences and conversations with colleagues. And certainly I'd be happy to invite some of my friends on who do some really interesting work, like, forensic psychiatry. So people who are getting requests from the state or from the government, or because they're in legal issues too, and doing a separate type of evaluation that we call a forensic evaluation. So again, there's so many things in psychiatry that it's hard to cover them in just one quick video, but I at least wanted to give you a taste of what's available out there. Again, my friends, I appreciate you watching. I always treasure your time and our time together. Keep sending those really great questions, and as always, take good care and be well.